Okay, so let's study about pelvic infections. In this, we will first study about defense of the genital tract. So, in the defense of the genital tract, as we know that there is a connection between the lymphatics and blood vessels of one pelvic organ to the other pelvic organ. So, there are more chances of infection to be spread from one pelvic organ to other pelvic organ, and there is direct communication of the peritoneal cavity to the exterior through vagina. As you know that this is abdomen and this is the peritoneal cavity. These are the ovaries, these are the fallopian tubes, this is the uterus, this is the vagina. Peritoneal cavity is in contact with the ovary. From ovary, the infection can travel through the fallopian tube through the uterus, and through vagina can spread to the exterior. In spite of this, that there is a lot of connection of the lymphatics and blood vessels between the pelvic organs and the peritoneal cavity to the exterior, then also the pelvic infection is not spread is in as much intensity as it could be. This is because of the defense mechanism. So what are the defense mechanisms that play a role in giving protection from pelvic infection? So first we will study about the vulval defense. In vulval defense, there is the anatomical defense and there is the physiologic defense. In anatomic defense, as you know that the vulva, there is apposition of cleft by labia, labia minora, labia majora. So they are in the apposition. And next is the compound racemose type of Bartholin gland. So first was apposition of the cleft by labia, and next is the compound racemose type of Bartholin's gland. Next is the physiologic defense. In physiologic defense, so there are some apocrine glands that are present in the vulva, and these apocrine glands have the fungicidal action. Next is there is natural high resistance to infection of the vulval and perineal skin. Now we will study about the vaginal defense, how vagina is protected from the pelvic infection. So in this also there is anatomic defense and physiologic defense. In anatomic defense, it is same that there is apposition of anterior and posterior walls with its transverse rugae. So as you know that if we see the cross section of the vagina, so the vagina interior wall and posterior wall are in opposition, and there is very less space for the infection to go inside, and there are transverse rugae present in the interior and posterior wall. And next is that the vagina is covered with the stratified epithelium, which is devoid of any glands. Next is the physiologic defense. In physiologic defense, this is maintained by the hormone estrogen. So how it is maintained? As you know, in newborns means 0 to 10 days. So in 0 to 10 days, due to the maternal estrogen, the vaginal epithelium is multi-layered, right? And there is lot of glycogen is present in the vaginal epithelium, and due to this, Dordalan bacillus are also present, which will make the vaginal pH to be acidic. Acidic means the pH will lie between 4 to 5. And as we go to the puberty, from 10 days of birth to puberty, the epithelium will be thin because there is no activation of the hypothalamo-pituitary axis, and there will be no GnRH release. There will be no activation of ovaries so that they can release estrogen. So hence there is no estrogen production until puberty. So the epithelium is thin. Glycogen will be absent. If glycogen will be absent, then Dordalan bacilli will be absent, and the pH will be neutral or alkaline. That means the pH will lie between 6 to 8. Let's talk about the childbearing age. So we know that after puberty, the hypothalamo-pituitary axis gets activated, and there is production of estrogen, and due to the presence of estrogen, the epithelium will again become multi-layered, and the glycogen will be present. So the same system as we have seen in the newborn, the glycogen will be present, the Dordalan bacilli will be in much amount that they will make the pH of the vagina acidic, and acidic pH means the pH will lie between 4 to 5. And as we talk about the post-menopause, in post-menopause also that there is a deficiency of estrogen, the epithelium will become thin, there will be absence of glycogen, and there will be absence of Dordalan bacilli, and the pH will be neutral, not alkaline, only neutral. So this is all about the vaginal physiologic defense, and by this we were able to know that the estrogen has its effects on epithelium of vagina, and by its effect, the pH is maintained. And we know that the Dodlin bacilli only grows in the acidic medium with pH 4 to 4.5. The Dodlin bacilli grows in pH 4 to 4.5, and if the pH is raised above 4.5, then the normally organism that are present in vagina will start growing. Okay. Next, we will see about the cervical defense. In cervical defense, again there is the anatomic defense, there is physiologic defense. In anatomic defense, the same that there is racemose type of Bartholin glands, and there is presence of mucus plug. And in physiologic effect, the same that there is bactericidal effect of mucus. Next, we will see the uterine defense. In uterine defense, as we know that there is cyclic shedding of endometrium, and there is closure of ostium of fallopian tube because of the slightest inflammatory reaction in endometrium. So these are the uterine defense. Next, we will see the tubal defense. So the anatomic defense and the physiologic defense. In anatomic defense, there is integrated mucus plica and epithelial cilia are present. And physiologic defense, there are peristalsis of tube and the movement of cilia towards uterus. So the cilia moves towards the uterus. Now we will see what are the causative organisms that are involved in pelvic infections. So the causative organism that are involved in pelvic infections, they are mainly the normal flora of vagina and endocervix, or exogenously it can be through the sexually transmitted infections, STDs, or it can be due to following induced or unsafe abortion. After abortion, the female can have the pelvic infection, or during delivery. In what conditions? In unhygienic conditions. So these are the causative organisms, are the causes that are responsible for the pelvic infections. Now in detail we will study about the organisms that are involved. First are the pyogenic. In pyogenic, these are responsible for 50% of infections, and these are the commonest types. In this, there are two categories: aerobes and anaerobes. In aerobes, there are gram positive and gram negative organisms. In gram positive, this is Staphylococcus, and in gram negative, E. coli, Pseudomonas, Klebsiella, Neisseria, gonorrhea. So these are the organism aerobes which are responsible for the pelvic infection. And anaerobes, we will divide it into gram positive and gram negative. In gram positive, the anaerobic organism is Streptococcus, Clostridium welchi, and Clostridium tetani. And in gram negative, mainly is bacteroids group, and in this bacteroids fragilis. Okay, so these are the pyogenic organisms. We have divided it into aerobes and anaerobes, and they are further divided into gram positive and gram negative. In aerobe gram positive, Staph is the organism. In gram negative, E. coli, Pseudomonas, Klebsiella, and Neisseria gonorrhoeae. And in anaerobes gram positive and gram negative, in gram positive it is Streptococcus, Clostridium welchi, and Clostridium tetani. And in gram negative it is bacteroids, and in bacteroids the commonest is Bacteroides fragilis. Next are the sexually transmitted disease. So what are the organisms that are involved in sexually transmitted diseases? So the organisms are Neisseria gonorrhoeae, Chlamydia, Trachomatis, Treponema pallidum, herpes simplex virus type 2, human papilloma virus, Gardnerella vaginalis, which is also known as Haemophilus vaginalis, Haemophilus Donovan bodies, and HIV-1 or 2. So these are the organisms which are responsible for sexually transmitted infection: Neisseria gonorrhoeae, Chlamydia trachomatis, Treponema pallidum, herpes simplex virus 2, human papilloma virus, Gardnerella vaginalis, Haemophilus ducrei, Donovan bodies, and HIV 1 and 2. Mostly we have studied all the organism. Next is the parasitic cause. In parasitic, the organism is Trichomonas vaginalis. Next is the fungal. In fungal, it is Candida albicans. In viral, it is herpes simplex virus type 2. Human papilloma virus, HPV, HIV, condylomata acuminata, herpes simplex virus type 2, human papilloma virus, next is tubercular. Tubercular is Mycobacterium tuberculosis. So these are the organisms that are responsible for the infection of the pelvic organs. Now, what are the modes of infection? Modes of spread of infections. So, in modes of spread of infections, there are 4 modes by which the infection spreads. First, we will study about the through bloodstream. Through bloodstream, it is tubercular. Through lymphatics and pelvic veins, it is that post-abortal or puerperal infections are spread by this route, or pyogenic infections except gonococcus, because gonococcus is spread through continuity and contiguity. And from adjacent infected extragenital organs जैसे कि from intestine. So there are 4 modes of spreads of infection. It can be spread from the intestine or the extragenital organs. It can be spread through the bloodstream, like of tubercular. It can spread through the lymphatics or through the pelvic veins, as in the case of the pelvic infections. As through the pyogenic infections, except of gonococcus. Gonococcus is spread through contiguity and contiguity. And in post-abortal and puerperal infection, they are also spread by the lymphatics and pelvic veins. Next, we will study about the acute pelvic infection. In acute pelvic infection, there are 5 categories. First The most important is the PID. PID is pelvic inflammatory disease. Next one is following delivery and abortion. Next one is following gynecological procedures. Next is following insertion of intrauterine devices. And next is secondary to other infections like that of the intestines, like appendicitis. Now we will study about the pelvic inflammatory disease, which in common language we use it as PID. So what is the definition of pelvic inflammatory disease? Its definition is that it is the disease of the upper genital tract that we know. Next is it is the spectrum of infection and inflammation of the upper genital organs that typically involves uterus, fallopian tubes, ovaries, pelvic peritoneum, and surrounding structures. So, pelvic inflammatory organs, we will start from the ovaries. It involves ovaries, then it involves fallopian tubes, then it involves uterus, from ovaries it can spread through the peritoneal cavity and to the surrounding structures. It has the surrounding structures like ureter, so in infection of these organs there will be inflammation of ovaries, fallopian tubes, uterus, peritoneal cavity, and surrounding structures. And in PID, the infection ascends upwards. It will go, it will ascend from cervicovaginal canal to the uterus, from the uterus to the fallopian tubes, then to the ovaries, then to the peritoneal cavity, then to the surrounding structures. So this clinical syndrome is not related to pregnancy and surgery. So from the respected organs that are involved, we use the specific terms. One is if the uterus is involved, it will involve the endometrium. So the word used for it is endometritis. If the fallopian tubes are involved, then the term used is salpingitis. As we know that fallopian tubes are also known as salpins, so the word salpingitis means the inflammation of the fallopian tubes. Next, if there is inflammation of the peritoneal cavity or pelvic peritoneum, then this will be known as peritonitis, pelvic peritonitis. And the severe condition can also be that there will be abscess formation, that is tubo-ovarian abscess. So these are the structures that are involved. Cervicitis is not involved in PID. If we talk about the epidemiology of the pelvic inflammatory disease, then the incidents are on rise due to sexually transmitted diseases. The incidents vary from 1 to 2% per year in sexually active women, and in these 85% are the spontaneous infection, and 15% are due to some procedures like endometrial biopsy, uterine curettage, insertion of IUD, and hysterosalpingography. There are certain changes that are seen in the epidemiology. First is there is shift of inpatient PID to outpatients, so we can treat these patients now in OPDs also. No requirement for admissions. There is change in clinical presentation, that means now less severe disease is commonly present. And next is that there is shift from chlamydia trachomatis from gonococcus. So now chlamydia trachomatis cases are more present. Now let's see what are the risk factors for having PID. First is menstruating teenagers, multiple sex partners, absence of contraceptive pill use, previous history of acute PID, intrauterine devices users, and area with high prevalence of sexually transmitted diseases. Why there is increased chances of PID in menstruating teenagers, as we have studied that in puberty that the vaginal epithelium is thin, so there are high risk of genital tract infection, and in the teenage period there is low hormonal defense